Good afternoon to everyone present here with us today. This is Shriyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned Professor Dr. Arul Raj Sundram. Sir is MD, FRCP, PhD, DSc, Chairman and Head of Acute Medicine at Sundram Arul Raj Hospital. Dr. S. Arul Raj Healthcare, Education and Research Foundation, Tamil Nadu. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is AI in cardiovascular disease. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Thank you so much for the kind, introduction. Warm good evening to all the participants of this very interesting, session of AI in cardiovascular disease. AI does not mean Air India. It means artificial intelligence in cardiovascular disease. See, today cardiovascular disease is going upon to a very great heights, and artificial intelligence is penetrating into all branches of medicine. There is even a doubt, can it replace doctors? All those things are there. I'll just briefly communicate to you what exactly is artificial intelligence, why cardiology needs this artificial intelligence, and in what areas it can penetrate, and what are the advantages, and some conclusions we'll put across. As all of you know, 1/3 of the world's population has cardiac disease. See, it is one of the top online non-communicable diseases. 80% of the population in developing nations have cardiac disorder, out of which 60% is preventable. And the disorders include, coronary artery disease, myocardial infarction, valvular heart disease, congenital heart disease, myocarditis, pericarditis, and endocarditis, infective arrhythmias, or we call them dysrhythmias, tachy or brady, and heart failure, acute and chronic, and hypertension. These are all the conditions that are involved in cardiovascular disease. What artificial intelligence can do in CVD is a small introduction. Disease phenotyping. What type of disease you have? Valvular disease, or coronary artery, or myocardial disease, or pericardial disease. It enhances the diagnostics as well as improve the prognostication and facilitate treatment decision. There are many, algorithms available. It can help you to, choose which one for which disease and which patient, making cardiovascular therapy more personalized, or individualized therapy. It is possible. Artificial intelligence is not new now. We are started using it even from our mobile phone. More computer power, more data, and better algorithms are there. The terminology of artificial intelligence was first described in 1956 by John McCarthy. He meant it for a combination or a co-working of science and engineering and making intelligent machines. See, all of you know that intelligence is human brain. It is there in the prefrontal cortex through the neurons. And same way, multiple neurons have been formed, and it has caused intelligence in the computer. That is why it is called as an artificial intelligence. And there is a learning also taking place through that. There is a machine learning. And deep learning, there is a multiple layer of learning is there. And this is a chat GPT, which is now become very popular. Pre-trained transformer language model is there. You want to write an article, you need not go on look into so many references and essays, news bulletin, emails. In all these things it is done. And GPT has cleared the United States medical license examination, USMLE. To that extent, it has a lot of knowledge. Meta AI is an assistant developed by Meta. It's a parent company of WhatsApp. You see that even in your WhatsApp or Meta AI, what do you want to ask? Meta AI is now a multilingual, more creative and smarter form of artificial intelligence. Now the future is generative AI. Generative AI can detect, that is detection. Now it is not there, but what could come next, either in the drug supply or the business proposals or digital side, everywhere it can come. That is why this is called a generative AI. And the physician versus artificial intelligence, human. A doctor could say, I mean, a senior doctor could have seen about 200,000 patients during his lifetime. All its memory, I mean, it is there in his, I mean, neurons. And in artificial intelligence, I mean, it is much more powerful. I mean, about 150 years of British periodicals, it can totally assimilate in a very lesser time. What I try to say is the memory is, I mean, great for I mean physicians and much more great for artificial intelligence. And what artificial intelligence does, it makes the diagnosis early as well as fine tuning the diagnosis and prediction of complications. For example, somebody has got hypertension. When he will get a heart attack, when he'll get a, I mean, heart failure, it will be able to say that. Somebody has got a diabetes. I mean, when this fellow will go for a renal problem, and that way it can always predict the complications. And in applications in diabetes and cardiovascular disease research is going on, and lot of inputs are there. Why does cardiology need artificial intelligence? Very interesting question. Most of you in the participants will have this idea. Why cardiology needs this? To evaluate a cardiac disease and predict the occurrence. See, for example, there is a 45-year-old man who is a diabetic or a hypertensive. When this fellow will develop a myocardial infarction, that could be predicted. And what complication he will have? Whether he will have a heart failure or he will have a heart block or any other tachyarrhythmia, and when he can we die? The doctor may feel he is good, but the patient may feel he is good, but suddenly he may die. We don't know what is the, background. All these things could be, done by diagnostic algorithms and different diagnosis. And the most important thing is remote management. See, you can fix a sensor to the patient, and the consultant or the cardiologist can be in his home or outside this country. From there, a distant management, a remote monitoring management can be done. These are all the areas why we need artificial intelligence. And there is evidence is there is complex conditions involving heart failure can be very well managed. The glabella BP tracking glasses are very much known to all of us. And more than that, you may all say there is a great patient satisfaction. Patient feels that he is very much satisfied than the face to face visit. And in AI, as I told you, you can use a wearable technology to monitor the patient's condition, and telemedicine, wearable sensors, and there is Augusta. Augusta is a miniature ECG which can detect a lot of complications in cardiac patients. Ladies and gentlemen, the cardiovascular disease, the area where artificial intelligence we are talking can have a therapeutic side and a diagnostic side. Diagnostic side, ECG, arrhythmias, pulmonary artery pressure. We can measure it. Thereby, you can say this chap is going to develop a heart failure in 4 hours. And in the patient with the left heart failure, lung fluid volume, you can detect and see how much of diuretic have to put in, or whether he has to go for a, artificial ventilation, a BP, pulse, diet, personalized diet, exercises, and walking, and then physiotherapy, as well as pulmonary function therapy, and then sleep and drugs reminder. Even, an artificial intelligence can remind, hello, you will have to take your tablet now. And in therapy side of it, dysrhythmia, there is a role we'll see, hypertension, hypotension, early heart failure, coronary disease, and it predicts the complications. See, this is we have all of you might have seen echocardiography being done. This is a AI applied to the echocardiography. Here you can see the anatomy as well as the functions, and the end systolic and diastolic frames can be very easily identified, and a wall motion abnormality that we see as a part of cardiac involvement, we'll be able to see that very well. And you can have a 3D, this is a 3D view of the left ventricle. If you see that, subsequently you will see only the left ventricle in the 3D format, and you will be able to see any anatomical defects or any foreign body inside. This is the left ventricle. This is the right ventricle, which we are able to see in 3D. This is a interesting thing in artificial intelligence. You see everywhere girls and boys today take selfies, but you take a selfie, and from there itself we will be able to make out your hypertension. That's an important of it. And for want of time, I am just pushing a video. This is another video, artificial intelligence in cardiac diagnosis. There is a stethoscope, which is, AI enabled. Just to keep the, the chest piece on the patient chest, it will be connected to your, mobile phone. All these sounds, either in the cardiac side or in the respirator side, will be recorded on your mobile, and you will be able to make a very good diagnosis. This is very, 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 important. And this is a digital, stethoscope, wherein you will be able to make out a diagnosis of valvular disease very excellently. Today, ECG, tele ECG is no longer a news. You take an ECG, forward it. But even on your mobile, you can take your ECG. You'll be able to see that. More important, that is ECG analysis. A cardiologist or a physician makes an analysis, but an AI can make an analysis, and it can detect not only the current one, it can detect it can predict the future cardiac arrhythmias also, and coronary artery disease and left ventricular function. We'll see that as we keep moving. It's one of the, things that I saw that in Singapore, a small machine here. You keep both your fingers on both sides, you will get the ECG. All the 12 lead ECGs will be there, and the reporting will also be there. It is a form of artificial intelligence in, ECG diagnosis. This ECG, Mayo Clinic have formed a formula, and that is, it will be able to identify prior episodes of AF. As such, currently, as you see the patient, it's sinus rhythm, no atrial fibrillation. He could have had an AF, in between, or he can have AF later. This helps the clinician to put the patient on newer oral anticoagulants, so that we will be able to prevent ischemic stroke. That is very, very important. This is a creation of AI enhanced sinus rhythm. Here, we are able to make a diagnosis of atrial fibrillation. Very simply done it. And there is a, from the ECG itself, a left ventricular dysfunction. It's a study wherein 44,000 and 45,000 patients have been done. This is not from an echo, but from the ECG, we will be able to make a diagnosis of a left ventricular ejection fraction, how much it is, and then it can be compared to the echo. And artificial intelligence applied in ECG can make a diagnosis of aortic stenosis. There is a structural heart disease. Without an echo, you will be able to do that. These are the advantages of ECG reading with AI. ECG reading with AI. Here there is a left ventricular dysfunction. There is a graph has been done, how the EF is there, which was supposed to be high, but actually when ECG reads, it is low. Ejection fraction, we are able to see that. Simple face. When I use AI-based a face application, we will be able to predict a coronary artery disease. You take a photograph here and say this fellow will have we will develop a coronary disease after this time, by analyzing the hair structure, wrinkles on the forehead, around the eyes, and the chin. These are the advantages of using it. This is how this photograph is there. We have taken a photograph. We will be able to see that and see the validation and the test group. We are able to detect the presence of coronary artery disease by a single facial photograph. From the voice, see, many things we have been telling from the voice. As the patient is talking to you over the phone, you will be able to make out the coronary artery disease. And the only problem, if there are extra noises, there will be a problem. You see the retina. The retinocardiovascular disease, from the retina itself, you can see the vessels through AI, and it can predict or estimate how much cardiovascular disease this patient has got. Very high sensitivity, specificity, and very good predictive values there from the retina itself. Normally, our ECG needs 12 leads. You have to put it on leg, arm, and chest. Here with AI, when you do that, 3 leads are enough. 2 limb leads and 1 chest lead is enough. Precardial lead, you will be able to take an excellent ECG and an interpretation also. This is what I was telling you. The patient is making a phone call. If we are able to apply, this is a Mayo Clinic study. I mean, if you are able to apply AI, we will be able to predict the coronary artery disease by the voice itself. That is a very important one. This, I mean, echo, I mean, this is real-time echo, which we see a patient is this side, the consultant is other side. Even in CT, now it is going on a digital way of, I mean, distance. But in echo, this is a new one. You can do that on your mobile itself with a, I mean, frame. This is the advantage of it. Patient can himself see, I mean, see, and even arterial Doppler and a vascular study and cardiac study can always be done. This is an, I mean, advantage of AI here. And you can detect diabetes in one's own, I mean, heart rate. I mean, there are watches, you see that, are wearables, you see the heart rate. From there, you can predict the, I mean, diabetes. Is a point of contact equipments are there? Any number is there? The pulse oximeter, blood pressure, sugar, spirometry, all these things can be connected to AI to detect the diseases. And from the echo, we will be able to see an imaging, you will be able to see the left ventricular ejection fraction by artificial intelligence. And the computer tomographic coronary angiography can help you to identify the plaque here and the precardial fat also, so that we will be able to predict coronary heart disease and stage it also. And you can say within this 6 months or 1 year you will get it. An AI based CTC analysis, one stop shop here in predicting future cardiac events. There is the robotic, magnetic, MRI. By the navigation technology, catheters can be placed. Cardiac catheters can be placed in the right place. Either you want to do an angio or you want to do a, I mean, uh, uh, you do an EPS study, electrophysiology study, you can place the catheter in the right place and you can make the studies. And if you want to do an ablation also, you can do that. It's a very important thing. AI in cardiology, we call it under the category of penetrations. Penetrations. And another is Artica, artificial intelligence for clinical cardiac navigation. And it will be able to see that CT scan, can be, read by applying artificial intelligence. You can make a correct diagnosis and the complications also. The prediction of complications. Artificial intelligence in cardiac magnetic resonance imaging can do a new phenotypic classification of patients with preserved ejection fraction or reduced ejection fraction or mid-range also. And the complications can very well be done, and PET CT scan data can be interpolated against CT, CT scan, and the accuracy is about 95.4%. Is an artificial intelligence in cardiology. You can have a health ATM. You stand here, you can just touch the screen, say what all you want. You are standing here, you will get all the information. Like the ATM, you take the money here, you get all your information. This is a kiosk in the hospital. Before going to the doctor, you go there and get all your chat pad. You can always take give a history, and basic investigation can be done on the kiosk itself. Then you see the clinician. And EICU is not a rarity here. All of us have the EICU on our mobile, so that our mobility is not restricted. This is another important thing that has been done in All India Institute of Medical Sciences. If my memory goes right, is in Delhi. A patient is on ventilator for about 5 years. Like that, many patients are there. He is not able to go home. Home ventilator, he is not able to. They have detected, they have invented a low cost ventilator by using smartphone. By using a smartphone, very simply, this is the only thing, and this has been developed by those two people, a robotic scientist and a neurologist, and they have developed a ventilator support. You can see that this is a normal ventilator. What all needs here? Here you need only this phone and this small equipment, and the patient goes home. The cost is about 50 to 60,000, and this is a very affordable and acceptable way of long-term ventilation. This is the patient's father who had been going on spending for his sons and spoiling the family, and now he is so happy to take him home with this, I mean, smartphone based, ventilator. These are all artificial intelligence. This we are coming into the therapy of cardiology. We have seen the diagnosis, we have seen the prediction, we have seen the penetration coming to the manner. This is a soul west. People who are likely to get rhythm disorders can wear it and go. If there is a ventricular fibrillation, immediately a shock is being given. I mean, through artificial intelligence, the patient life is saved. In our Rishikesh, All India Institute, all drugs are being delivered through, drones. Usually they do it for tuberculosis, and they can always do it for cardiac problem also. This is one of the scientific endeavors in Singapore on digital health, wherein a defibrillator can be transported through drone to the sites, and self-flying drones are also there, can administer the shock, and the patient can be recovered. In cardiology, patient can be in any village, and the cardiologist can be in any city. They are very much linked here. It's an advantage of it for making diagnosis and prediction. Any number of artificial intelligence based biosensors are available. Patients can take it, and for hypertension control and arrhythmia detection, even Apple Watch has an AI, and it has been cleared now. This is a remote monitoring of heart failure. Your patient has gone home, and you can monitor his pulmonary artery pressure, and you can tell that you are likely to get into pulmonary right ventricular failure. Please go to the doctor, a nearby doctor, or come out to the parent institution. You can always monitor the lung fluid also. When it is going on increasing, you can predict a heart failure, and you can direct your patients. Now Apple watches and any number of ECG watches have come, and these watches are capable of detecting atrial fibrillation also, and a wearable cardiac ultrasound imager. Patient can, something like a pacemaker can fit in and keep on doing it, and his cardiac activity will be continuously monitored by the base hospital. And artificial intelligence and machine learning in intervention cardiology. See, suppose patient comes to you with a chest pain, ECG is not clear. You will have to send him for troponin, and you will have to wait for at least 1 to 2 hours here. Here, if you apply a artificial intelligence on the ECG, it will make a diagnosis of ACS. Patient, if it is not there, patient may not get admitted. He can go home. And diagnosing a heart failure also same way could be done. Patient has come with breathlessness, cardiac or respiratory. You can make an immediate diagnosis here, and you can always have the statistical models have all been gone. The complications prediction like heart failure, valvular heart disease, Takotsubo syndrome, all can be diagnosed very nicely, and long-term outcomes. Patient has been discharged. Usually, is put on antiplatelets and anticoagulants. Any evidence of bleeding, anything can always be detected and predicted also. And artificial intelligence based or assisted clinical decision making is very, very useful, and it will make the medicine more precise and faster, and risk prediction is more precise. And there is a question whether we will need less number of physicians in future. So physicians shortfall is a very important thing for emergency or remote areas. Whether this can be managed by artificial intelligence is a question which is being answered. This is another. In Japan, one medical link system is available. It is able to track and manage blood pressure also. Ladies and gentlemen, the opportunities of AI application in cardiology, one is precision, very much personalized, and it penetrates. If you want to go inside the heart or vascular system, it supports you, and it tells you prediction, which patient will develop arrhythmia, which patient will develop heart failure, which patient will die. And personalization, it is a personalized medicine. It is diet and drug therapy, all can be personalized for the patient so that effective treatment is there. In future, scope is enormous. You can have a virtual nurse or a virtual doctor and virtual diagnostics. In research, data collection is the key in artificial intelligence. Therefore, all these data can be used for research. In future, for the training of the youth, this AI is going to be very, very useful in clinical medicine and adoption of AI. Now, 47% of the clinicians have adopted AI. Probably in course of time, we will be, accepting and adopting more. And there are certain ethical issues because you are collecting all the data and data is being stored there. And ethical guidelines have been introduced. There is a Data Security Act has come, a bill has come, act has to come. And this is not going to replace, as per experts' view and my view. Artificial intelligence is not going to replace clinicians. It is a it is a powerful extension of physicians' intellect. See, physician and cardiologists are considered as a highly, intellectual clinicians, and it is an extension or powerful strengthening of their, clinical intellect only, not a replacement. This is I was there. Recently in a medical school at Andhra Pradesh in India. Here, what all you want to learn on a patient can be, learned on, manicures. Here you do an angiography, you do it on this, not on human beings. Learning. And anything you want to do. You want to do an echo, you want to do an ultrasound, you can do that. And you want to learn an intervention through, gastroscope, you'll be able to do that. And here, you will be able to see all the vascular system, this is a learning technology. It's called a smart skill labs. Not only the theory part of it, skills, how to do it, how to do an endoscope, how to do an angiography. How to place a, pacemaker. All these things can be done. This is in that, and you will be able to learn it very nicely. People who have got an opportunity can go and have a look at it. Now, ladies and gentlemen, in the AI applications in cardiovascular disease, aids for accurate diagnosis and unnecessary procedures can be avoided, and prediction of complications will be there. And now the actionables are AI in CVD helps clinicians, makes precise diagnosis, predict cardiac complications, supports effective timely management. All physicians must embrace, adopt, and practice AI. Techno savvy and techno acquired clinician is the right answer and the best option. The future is very glorious if a proper balance between technology, clinical skills, and human values are achieved. AI, powerful extension of clinical intellect, as I said. Thank you, ladies and gentlemen. If you want to share some of your thought process, I would love to hear.
Thank you so much, sir, for your wonderful presentation. We do have some question if you like to take that up.
Please. A few questions, that's all.
Sure, sir. So, sir, the first question is, what is the potential of AI in optimizing medication adherence and lifestyle modification strategies in cardiac patients?
See, in cardiac patients, if you feed the data, individualize, it will individualize. Suppose somebody is about 60 years old, cardiac condition is there, he can't be made to run. There will be a personalization of his diet. It will give you the chart. He can take this. In that you can choose. It will tell you only this much exercise you can do that. And drugs has been prescribed. Not only that, whether you take the drugs without forgetting. Yes, now it is 9 o'clock. You should take this tablet. You should take aspirin or you should take, Ramipril, and that way it goes. It's a personalized way of his lifestyle modification and drug therapy and follow up. And in future, every department will have an IT department, every hospital. Like a radiology and imaging department, they will have IT department. All your data, if you are fixed with a remote monitoring, all your data will go to the doctor. Whenever it is needed, doctor can see that. Not only that, warning signs can be given. Oh, this chap is not right. Probably his coronaries are getting blocked again. Like that, warning can be given. That's very, very important.
Thank you, sir. The next question is, what are the challenges of integrating AI tools into electronic health records in cardiology?
See, not only in cardiology, anywhere, the issue is always with the EHR, electronic health record. Actually, I have even proposed like your Aadhaar card, you must have a digital health card. And in our own nearby, in a smallest country, PHN is the personal health number. Like your Aadhaar card number, it is same throughout that country. And whichever country he is there, he gives that number, and they seek into that country. His health data will be available. That is the advantage of a health record. See, for example, you go out, meet with an accident. Nobody is there. Some standby, bystander takes you to the hospital. The doctor does not know what drug you are on and what is your basic disease and to which you are acceptable, to which you are not acceptable. If you have that health record or a number, the doctor can immediately find out you are a diabetic, you are on this drug, you are having a bleeding, you are on antiplatelets or you are an anticoagulant. That way, the EHR will help. Now, EHR has to be brought to that level. Sure, in our country it will happen.
Thank you. So there's one last question. What research areas in AI and cardiovascular disease are currently underexplored?
See, the underexposed areas are, earlier the dysrhythmia detection was possible, management was not possible. But now this our Rishikesh AIMS has detected a defibrillator that can be transported through drone. That way, the treatment side is also gone. And there is a self-flying drone. You can just press it and say, at this particular kilometer, at this place, X is there, and it will go and it will offer the defibrillation also. This is management. Now the generative AI is detecting a lot of new drugs. New drugs. See, cardiac patients are there. Our pharmaceutical companies do a lot of research and try to bring out drug. For one drug, it takes 10 years. And they will have to pay, shell out $1 billion. Whereas here, if you put it in generative AI, they are developing it, it can tell you. We know what are the drugs that are not possible. Somebody has got a VC. He has to be on a beta blocker. How to fit in? We as doctors try to modify and remove beta blocker, and this can give you a new format of beta blocker. This can be given to you. Like that, in drug therapy and procedures, all innovations are taking place. These are all the areas. Even in a data one, yeah, data security is not still there. The owner of the data is not the patient. Private this thing, and he has to be given a password, and only with that password his doctor or anybody can. This does not come. There are a lot of gray areas which are getting evaluated, and sure, in a very short time it will all be rectified. Thank you.
Thank you, sir. Thank you so much for answering all our questions. That's all from our audience. Before concluding, sir, any take home message from your end?
See, my take home message will be, today is an era of artificial intelligence. Right from your mobile, everywhere it is there. In cardiovascular disease, which is the number one killer disease, we should adopt it. People think that the doctor's touch is missing here. Don't think. Probably slowly that will also be put in. That is an area which is being also evaluated. We should learn about AI, and we should try about AI. We should adopt AI so that personalized better care can be given to our sick patients. Okay.
Thank you so much, sir,
Thank
for
you, ma'am.
joining us today. With your permission, I would like to conclude today's session. Thank you.
Okay. Thank you.